Welcome to Vitality VIP's Wellness Elite channel. Let's start.
Hello, I'm Dr. Mary. Today, I'll tell you about the health benefits of drinking purified sodium bicarbonate, soda, with water. There are numerous articles on the internet about this subject, but keep in mind that some of the claims made are not scientifically supported. As a result, I have gathered the most recent scientific knowledge and will tell you how drinking soda with water can benefit us based on scientific studies. Today, we'll also answer many frequently asked questions, such as how much soda should be consumed, what are the contraindications for consuming it, what side effects it may cause, does it interact with medications, does it relieve heartburn, does it destroy our teeth's enamel, does it help with acne treatment, and many other intriguing questions. So, if you're interested in this topic, I recommend sticking around until the end. Today will be full of interesting information. Today's discussion will start with oral health. According to scientific studies, sodium bicarbonate has a very beneficial effect on our oral cavity. This is confirmed by one of many meta-analyses, which is the highest quality scientific research in which the action of toothpastes containing 20% and 35% of purified sodium was verified. The study showed that among people who regularly use these products, there was a significant reduction in plaque and inflammation and bleeding of the gums. I will add that the results with toothpastes containing only fluoride were not as good as those with the addition of sodium. Interestingly, other studies have shown that cleaning products with purified sodium effectively remove plaque from hard-to-reach areas of the teeth, including interdental spaces, where teeth touch each other. This is extremely important information, as cavities often form between teeth in spaces where only dental floss, which we are honest with each other, is used very rarely. Furthermore, purified sodium has significant bactericidal activity against pathogens of the oral cavity, including Streptococcus mutans, one of the bacteria causing cavities in our teeth. And most importantly, sodium raises the pH of our saliva, thus preventing demineralization of enamel, a weakening of enamel and increasing its remineralization, its rebuilding. Based on this, it can undoubtedly be stated that sodium bicarbonate-based mouthwash solutions can be a cheap and effective alternative to specialized solutions. Continuing the subject, it is worth mentioning the correlation between the use of purified sodium and the removal of our tooth discoloration. Scientific research confirms its safety, but also its high effectiveness in this matter. Healthy properties of baking soda are worth mentioning. A study was conducted on 31 patients with mild and moderate psoriasis. 12 of them took a placebo, while the other 19 took therapeutic baths with sodium bicarbonate, baking soda. Almost all participants who underwent the baths experienced a significant alleviation of symptoms such as itching and skin irritation. The improvement was so noticeable that they decided to continue the treatment even after the study was completed. Based on these findings, it can be concluded that using therapeutic baths with baking soda is a valuable supplement to conventional therapies for psoriasis. Moreover, there are strong indications that supplementing with baking soda can alleviate discomfort in the lower urinary tract. One study conducted on 33 patients with the above-mentioned condition showed that after 4 weeks of oral intake of sodium bicarbonate in 2 doses of 4 grams per day, there was an increase in urine pH and a decrease in frequency of urination. The problem of urinary incontinence and urgency was also reduced. In one study, 12 patients under the age of 18 underwent baking soda inhalation using a nebulizer. After this method was applied, a decrease in sputum viscosity and elasticity was noted. However, it should be noted that these are only preliminary observations and more research is needed to confirm the effectiveness of baking soda in treating respiratory diseases. And now, a point that will certainly delight all those who value physical activity. Reports from the world of science show that sodium bicarbonate, also known as baking soda, improves athletic performance in various sports disciplines, including boxing, judo, jiu-jitsu, taekwondo, and to a lesser extent wrestling. After the implementation of baking soda supplementation, either alone or combined with other substances such as beta-alanine, they saw an increase in overall hitting effectiveness, also known as accurate hits in boxing, improvement in upper body endurance in jiu-jitsu, and an extension of the attack time in taekwondo. Since baking soda increases physical endurance in athletes who perform repetitive and intense movements, athletes from other disciplines can also benefit from its valuable properties. According to literature data, its use improves results of intensive biking, short-distance runs, rowing, and swimming 200 meters. And now, a few important facts about baking soda itself. Question 1. How much baking soda should be consumed daily dissolved in water? According to general guidelines, the recommended dose is from 4 to 8 grams per day, dissolved in a glass of water. This means the minimum dose is about a small teaspoon, which is considered the standard, but with an increase in consumption, physical activity should also increase. Question 2. What are the contraindications for using baking soda? Remember that the aqueous solution of baking soda has an alkaline reaction, meaning it is basic, and its consumption is not recommended for individuals with metabolic or respiratory alkalosis, as this may worsen their symptoms. Additionally, it is not recommended in cases of hypocalcemia, meaning low calcium levels in the blood, and hypernatremia, meaning an excess of sodium in the body. Patients with congestive heart failure, kidney failure, sarcoidosis, dehydration, and water electrolyte imbalances should exercise special caution when taking it. Question 3. What are the side effects of consuming baking soda? At first, I'll emphasize that appropriate and short-term consumption of sodium bicarbonate typically does not cause any side effects. The problem arises only when it is consumed excessively and for a long period of time, especially intravenously. Among the most common complications are metabolic alkalosis, muscle pain and tremors, headaches, nervousness, anxiety, increased frequency of urination, nausea, vomiting, abdominal pain, and decreased potassium and calcium levels. In extreme cases, with the intake of very large amounts, there can be problems with breathing, tissue swelling, blood coagulation disorders, and even stomach wall rupture. Question 4. Does baking soda interact with medication, and what should it not be combined with? Remember, baking soda can interact with various drugs, including antibiotics, mainly minocycline and doxycycline, non-steroidal anti-inflammatory drugs such as sulfasalazine, misalazine, and ketoconazole, and also with agents neutralizing stomach acid. Question 5. How to consume baking soda? On an empty stomach or on a full stomach? Remember, baking soda should not be consumed when the stomach is full because it can contribute to its damage. The safer option is to take it on an empty stomach, of course, if there are no contraindications. Question 6. Does baking soda alleviate heartburn? Contrary to popular opinions, consuming baking soda is not the best remedy for heartburn. Although it neutralizes stomach acid, its effect is short-lived and provides relief only for a moment. Definitely a more sensible solution is to use means that alleviate heartburn, and their validity is supported by scientific studies. Question 7. Does baking soda destroy our enamel? The safety of oral hygiene products with baking soda has been thoroughly researched. According to numerous clinical and laboratory studies, toothpastes with baking soda are safe for enamel, as they have low abrasion. Moreover, as I mentioned earlier, they not only reduce plaque, but also show antibacterial and anti-inflammatory effects. Question 8. Does baking soda support acne treatment? Opinions on using baking soda for this purpose are strongly divided. Of course, on the internet, we can find information in various sources about its beneficial effects on facial skin, and many recipes for homemade masks with its use. There are also opponents of this method. It is worth noting that baking soda changes the pH of the skin and thus disrupts its natural barrier, which in turn leads to its drying out, irritation, excessive exfoliation, and proliferation of microorganisms. Question 9. Does baking soda cure diaper rash? Many popular parenting websites claim that rinsing the skin with a mixture of water and baking soda is an effective way to treat diaper rash. However, I would advise caution with this method. I have come across a case where a 4-month-old baby developed metabolic alkalosis due to the application of a large amount of baking soda on the diaper, not orally but on the diaper. Fortunately, after stopping this practice, the baby's symptoms subsided. And the bonus information for those who miss summer and mosquitoes. I remind you that baking soda can relieve the itching of skin after a mosquito bite. The American CDC recommends applying a paste consisting of 1 tablespoon of baking soda mixed with water to the bite site. To achieve the best results, it should be left on the skin for about 10 minutes. And that was the last information in today's video. Thanks for watching, and don't forget to subscribe our Wellness Elite channel.